Hello viewers. Today three of us are going to present about social behavior on compliance in COVID-19. Thanks to Louane Delbos and Chitraporn who helped to conduct survey of both French and Thai students. Today we are going to relate this research with topic of compliance in social behavior study. We will go through these 4 topics. We will start from introduction of compliance and end up with summary from research. So what is compliance? Let's consider a person comes to you and offer you or command you to do something. You can either refuse or comply that person, but you choose to comply. This is compliance. Complying others' request or command when you could refuse as optional is known as compliance. There are 3 key elements that affect compliance. There are reciprocity, good mood, and reason giving. Reciprocity is the expectation of returning favors when someone helps you or gives you something. Good mood is complying others when you are in good mood. Finally, reason giving is when you comply others because they give you reasons that satisfy you. For the data collection methods, we use survey research by Google Form. We ask their personal questions and then opinion questions related to awareness, sanitation behavior, and hygiene. Since the research is related to COVID-19 and social behavior of students, it is not theoretical querying students, so it is based on opinion to determine their behavior. And surveying is also known as opinion polls. This method fits for our research. We choose survey research because it is easily accessible for students due to the provision of internet, whether in Thailand or France. It is less time consuming and cheap methods of collecting data. I would like Chittraporn Chaidi to continue the survey structure of Thai students.
Compliance. According to a survey that Voravit and I conducted within the PSU University in Phuket. We get the results in pie charts and graphs. In this slide, we have personal information in order to confirm their permissions to study social behavior during COVID-19 pandemic as confidential. We target only university students. All 3 genders participate in this research, so we get a more clear result. We also confirm that all faculties in the university participate, not only some students. At least 1 student participates from each faculty which represent their faculty. We also managed to get most departments in university. Next slide, please. The first 2 questions are to know how aware and the risks are for knowing how preventive students are. And the results are positive. Although the degree of prevention has declined lately. Next slide, please. Question E was asked for their sanitation. Individually give different answer. So they randomly change their clothes before contacting with other athletes. It is necessary situations. In F, there is still chatting about the topic of preventive effort of COVID-19 regarding their eating habits. They show positive response here. But in contrast to their hygiene, student bedtime aren't fixed, but the majority show that they still consider sleeping. Next slide, their exercise and vitamins or supplements to increase their immune system show almost similar results. So about half of participants inclined to not involve in boosting their strength and immune system. And the rest do sometimes, but only 1 to 2 students have the habit. Their cleaning habits also show positive outcome. Although washing hands was crucial before, but these days the practice died down. 40% of students always wash their hands as a habit.
I will now talk about the French students. So the question is, after 2 years of COVID, do French students still follow the barrier gestures? So I conducted a survey on 15 French students, 7 men and 8 women. So concerning my country, the French students followed the barrier gestures carefully at the beginning of COVID and were very careful to protect themselves. I have therefore conducted a survey that will show their attitudes and the relaxation of barrier gestures over the years. So we can see first of all that lately the majority of students have not worn masks in the university. This is mainly due to the end of the compulsory restriction in school in France. So regarding social distancing in a crowd, a majority answered rarely and don't respect distancing. And regarding the use of hydroalcoholic gel, the majority uses it from time to time and another rarely. This shows that is still a priority for the students. For the question of hand washing in a crowd, a majority of students answered rarely or never. For this new question, we can see that 90% of the students don't change their clothes before going home, which shows that it's not a priority for them at all. For this new question, which is interesting, we can see that a majority of the students continue to raise awareness about COVID and that they have not forgotten after 2 years the importance of this fight. For the other last question, it often happens to the students to eat fruits and vegetables to stay healthy. And it's also important for them to practice a regular physical activity. On the other hand, a majority of students never take vitamins or other supplements to boost their immunity. As for cleaning the house, the majority of students answered often, which show that it's still very important to them. And finally, students sometimes or rarely wash their hands very frequently with soap in the university. To analyze my result, I asked them a very important question. Have you seen a decrease in barrier actions to protect yourself and others from COVID compared to the beginning at your university? And 80% of the students answered yes, totally. This suggests that students are less serious about barrier measures against COVID-19 after 2 years. Some things are still very important, such as cleaning the house, eating vegetables or playing sports, but these were the things that could be done before the pandemic. So less instinctive gestures like putting on a mask, using gel, washing hands are much less used by French students today. So this behavior can be explained above all the measures taken by the French government. Indeed, since the beginning of January, the restrictions concerning the wearing of masks and social distancing is no longer mandatory in France. So instinctively, young students prefer to stop protecting themselves because the virus is less virulent.
Thank you, Chitraporn and Louane, for your data analysis. Now I'm going to summarize our comparative survey data. We found that Thai students are considerate of masks, distancing, sanitizer, hand wash before going to crowded place, clothes changing for different places, whereas French students are more considerate of awareness, rest, and exercise. The similarities of both students are hand washing with soap and careful of healthy food choices. There are many variables that influence students, such as government policy, rules and regulations, and also norms, which change from time to time. According to degree of each factors, from survey we can determine that each place's situations are more or less reasonable enough for students to comply COVID-19 protection practices. Thank you. And this is it for our presentation, and hope it is helpful to you.